Back now to our top story this morning, and a reaction coming in on the audit of the Senate Finance Committee's health care plan, what we're learning so far. A vote on that measure is expected tomorrow. That's Tuesday. But the audit today, paid for by the industry trade group America's Health Insurance Plans, estimates that over the next decade, a family of four with employer-based or private coverage will pay $4,000 more per year for insurance. Some Democrats call the audit and the timing of the release a, quote, insurance industry hatchet job. Our next guest is the press secretary for America's Health Insurance Plan, Robert Zirkelbach. Sir, good morning to you down there in Washington, D.C. You're getting hit from all sides. We'll get that in a moment. First, tell me about the study. How'd you arrive at this figure?
Well, we asked PricewaterhouseCoopers to take a look at some of the recent changes to the healthcare reform proposal, particularly looking at the taxes on all of the various healthcare sectors, the taxes on the high-cost plans, looking at the personal coverage requirement and the incentive that it provides for people to wait until they're on their way to the hospital to purchase insurance, and then also taking a look at what's called cost shifting, which is where when doctors and hospitals get less money from Medicare, they just shift people with private coverage. And what the report shows is that these provisions are going to have significant unintended consequences by making healthcare coverage, the cost of healthcare coverage, increase dramatically
so then,
for
Robert,
individuals and families.
Or how did you find that in your audit, and the CBO did not find that in its own, I guess you could say, audit that it did last week of the Senate finance bill?
Well, again, CPO at total federal health expenditures, that's what they're looking at. What this report is looking at is what is the impact going to be on the health care coverage that men and women purchase every day or get through their employer. That's what this is looking at. It's showing that the cost is going to skyrocket. And what it shows is that if we want to get health care coverage more affordable, if we want to put our health care system on a more sustainable path, we've got to address the underlying medical cost drivers that are causing these costs to increase.
Explain this to me. Two basic conclusions based on my reading today. Lawmakers weaken the penalties for those who choose not to buy personal health insurance. The point is that you'll put it off if I'm not going to be penalized that much. And okay, maybe I get sick, maybe I don't. Is that a fair conclusion from the study?
Exactly, and we know that happened in the states. Several states tried to do the very market reforms that we're talking about today, but they didn't require everybody to purchase coverage. So what happened is people just waited until they were sick, they purchased coverage, and that just caused costs to spike for everybody in the healthcare system. It's not sustainable. And so if we want to make these market reforms work, and our industry strongly supports them, we've got to find a way to get everybody in the system.
And so far, well, your logic says if you weaken the penalties, you're getting fewer people in the system. Second conclusion you reach, any new fees? You talked about the Medicare cuts or the taxes on medical device companies or makers of medical devices. Any new fees or change in the cost will be passed on to the consumer. We pay in the end. That's your conclusion?
CBO said that 2 weeks ago in testimony before Congress, that if you have new taxes on health care coverage, both on the high-cost plans and on all of the different health care sectors, that just adds to the cost of providing coverage, and it's ultimately going to mean that families and employers are paying more. That's the wrong approach to health care reform and the wrong approach to getting health care costs under control.
Okay, you're taking a lot of shrapnel today. I'm sure you're already aware of that, okay? I want to go through it one by one, and then we're going to get White House reaction in about 5 minutes, and I'll get you to respond to that, okay? First, the spokesman for Max Baucus. The study is seriously flawed. They also conclude that the study does not consider any tax credits to buy private insurance, does not account for savings through the system, like cutting out waste and fraud, and does not account for those required to carry insurance, a topic that we just talked about. Your reaction to that, a seriously flawed study, Robert?
PricewaterhouseCoopers is a well-respected firm that does type of analysis all the time, and they have a long reputation of providing high-quality analysis, and we're pleased that they were able to do this report. And in regards to the financial assistance you referred to, that doesn't change the fact that the cost of coverage is going to increase considerably. Now, we're pleased that the bill does provide assistance to help people purchase coverage, but that doesn't change the fact that these costs are going up, and it's taking the healthcare trend and taking it in the wrong direction.
Robert,
and that's not really what we should be doing.
Why did you drop this? And some have already described it as a bombshell. Why did you drop it a day before the vote in the Finance Committee?
Well, the analysis was just completed this weekend because it looked at changes that were just made over the past couple of weeks to the current healthcare reform proposal. Many of these new fees added, the changes to the personal coverage requirement that we just talked about is very new. So it's an analysis that we did as quickly as we could because we knew that this data was important, and we felt we had a responsibility to look at the data to see how is this going to impact the coverage that people currently have today.
It had nothing to do with the vote tomorrow, the timing of it?
Well, it's very relevant to the entire debate. Of course, this information is very important to have out as we're discussing the best approach for health care reform. We think this data is essential to that debate.
So you would admit that? I mean, a day before the debate, your position is the information needs to be out there.
It does need to get out there, absolutely.
One moment here, okay? We're going to check into the White House in a matter of minutes here, too. I got to get a quick commercial break here. The White House said to be furious, though, over the audit of this health care bill. We've gotten a lot of reactions so far from our team down there, and also the White House Communications Director on health care. We will show you and let you know that what they were saying in reaction to this, and then get reaction from the health insurance plan there with Robert Zuckerberg. Don't go away. This is critical to our debate about the future on health care in America.